members and kids who quite often hit each other with things.
Yeah.
And I mean, would somebody who's 15 or 16 recognize this, or do you ever see anybody that young?
We do. And again, I want to emphasize how important it is to do the diagnosis and do the symptomatic treatment. If somebody is hit in the jaw, I would take them to a dentist within the first, I'd wait about a week to 10 days maximum to see if it didn't resolve itself. And if it didn't, then I think it's important to have it diagnosed. It could be a fracture. It could be a dislocation of the joint. It could be a tear in the disc. And those things can be treated and with very good results. But even so, you want to put patients on moist heat, for example, a little bit of rest and a soft diet, maybe some anti-inflammatories. Anything that will get you off the disability quickly is going to be better. Because we talked about how if a joint isn't used, it can atrophy.
Yeah, tell us the rabbit story. I like that.
Well, the rabbit story is the classic study that was done to treat joints. And the rabbits were divided into 3 sections. One group, and all the rabbits had damage purposely done to their knee. Now, one group of rabbits was put into the cage just to hop around on their own as they wanted to. Another group of rabbits was casted. They put casts on these knees, and then they took them off after 6 weeks. And the third group of rabbits were put on passive motion machines, where the knee was constantly in motion for the whole 6 weeks. And in the group of rabbits that had the cast, when they took it off, the knee had atrophied. They couldn't get use back to that knee. In the group of rabbits hopping around the cage, some of them improved, some of them didn't. They had a lot of function back, but that didn't heal. And in the passive motion group of rabbits, those knees healed completely. So that led to the current therapy for joint injuries, which is to get people back functioning as quickly as possible. Which
really is different than the traditional thinking, which is lay still or go to bed or stay off it and don't use it. I mean, even if you don't cast, you're supposed to rest it. So, though I'm thinking about the rabbits hopping, I mean, there's a degree of pain involved. And you had mentioned that there is an equivalent for the jaw with the passive motion.
This is actually a brand new therapy, and it was in this month's Journal of the American Dental Association, I believe. It's a passive motion machine for jaws, and it's a little sort of a clamshell thing that goes in your mouth, and it's attached to a handheld fluid-filled reservoir. And by squeezing this reservoir, it opens the jaw. So people have very limited motion, inability to open, which is a very common symptom of TMJ, can basically passively open and close their jaws without stress, and this has led to incredible improvements, actually.
Yeah, because I would think without something like that, your instinct would be, if you tried to do it, you'd resist it, just because it hurts.
And that's probably the worst thing you can do.
Okay.
Pain does have some very valuable aspect, which is to protect in acute situations, but in chronic situations, or likely to lead to chronic situations, you want to use that joint as much as possible.
Okay, so it's sort of, so for somebody like that, they would probably need to be taking anti-inflammatories or some sort of pain reliever, rather than just being in acute pain.
That's why we have our physical therapists who make us do these things, right?
That's right.
They're
what
mean,
a terrible job, huh?
They're mean, but they do us a lot of good.
Yeah, we really need them.
That's right.
The other thing that we had looked at as a cause, and we'll get back, is psychological stress. At this point, we're really head in that direction. You had mentioned the study where acute TMJ is often related to anxiety, and then the long-term chronic more connected with depression. And I know I was talking to my stylist before the show, and she says periodically she will grind, and then other times she doesn't grind. And I'm wondering if it's just periodic like that, whether it does damage or does it just sort of heal itself?
I think the reason why people grind it sometimes and don't at others is that for some people, grinding is just a stress-relieving habit. Some of us may bite our fingernails, and others may smoke cigarettes or do other addictive behaviors. But for some people, it's just grinding. And if it doesn't lead to debilitation, then, it's just one of those habits you have. It can lead to some serious damage to the teeth at times.
Yeah, I would think so, huh? Kind of wear them down a little.
Exactly.
Okay, but in terms of anxiety, now when people come and see you, do they usually know that they're anxious or stressed? I mean, do they tell you that? I'm undergoing a lot of stress.
Well, that's part of a good history. You really can't make a diagnosis of TMJ without taking an excellent history to find out if there's stress in that patient's life, if they've undergone a divorce or a recent job change or they've been laid off, something like that. And one of the key questions we ask people who say that, you know, they have TMJ is, well, tell me, when you're on vacation, do you notice any problems?
Oh,
You know,
good point.
and if they say, no, it actually feels a lot better. I just got back from a vacation, and it was great while I was there. That's classic for it being stress-related, being psychologically related.
Okay. And so can you treat people just from the dentist angle for that, or do they also
Well,
need to get counseling, or how would that work?
Sometimes they do need to get counseling. Sometimes we say, that, you know, you may want to think about getting some counseling. You may want to think about what it is that you have stressful in your life that you want to do something about. Now, we can prevent damage dentally. I can make a night guard, which is a soft plastic or a hard plastic device, which keeps them from damaging the joint or the teeth. But to get rid of the habit, the psychological source of their grinding, they really need to deal with the stress.
Okay. So that may be an indicator, too, I would guess, that even if you might miss the stress originally, I would guess you would suspect it if they just don't get better, too. I mean, I would think that even if they were unaware, but you're doing standard treatment and they're not
If you're doing
improving.
the soft diet and you're doing anti-inflammatories and they're not getting any better, there's I think, usually a stress component.
Okay.
So,
now, go ahead.
Yeah, I was going to say, in the study that I think you saw too, I think almost 80% or a little over 80% of people who developed anxiety or who developed TMJ had anxiety ahead of time. They were anxious before they even developed the acute TMJ symptoms, and it was even higher for people who had chronic TMJ. So there is a strong psychological component. And we get into the chicken and the egg.
That's right. Yeah, because having pain would certainly create anxiety.
Exactly.
I would be anxious, particularly if I didn't know what was causing it.
Exactly.
I mean, you can imagine all sorts of horrid things.
If you couldn't smile, you couldn't eat.
Sure.
You know.
Sure. Well, have you ever seen this running in families? Is this something that, because I imagine genetically our jaws are often the same. I mean, I don't know.
Where I've seen it is in mothers and daughters.
Oh, okay.
Which is not, I guess, that unusual, because we think that men and women probably have the same prevalence of TMJ, though we don't know this for a fact, but we see women presenting for TMJ about 4 to 1 over men.
Yeah.
Even in my practice, I think it's more by about 80 to 90%.
Women presenting.
Yeah, and frequently, you know, we'll see it in their daughters. Now, maybe there's a stressful family situation and you're seeing it develop in both, but you know, I don't know that for a fact.
Well, then, if it's the same with men, you're then suggesting that they're all just enduring it.
Well, men do tend to have we tend to have a tendency to deny.
Okay. Okay.
Not me personally, of course.
Well, of course not you, but enlightened men.
Yes.
So there would be that, yeah, they would just be tolerating. That's terrible. That's very sad to have to go through life like that.
I think
So it's good that the women at least come in. When I was looking at this study, the one we're referring to, they talked about not knowing, particularly with depression. I was quite intrigued with that. Trying to figure out if people with chronic TMJ, which means over 6 months, if they were actually depressed prior. And I couldn't figure out why depression would lead to TMJ. I mean, anxiety makes perfect sense to me because you tense everything. What are your thoughts on that?
On depression leading to TMJ? It may simply be that the depressed person exhibits that depression through self-abusive patterns like grinding, like clenching, and that if that goes on long enough, they develop this chronic TMJ syndrome.
Okay.
And you're the expert on psychology, but you know, I've thought about this, and I don't see any other way this would probably happen.
Well, and it makes sense. And also what happens with depression is your whole system slows down. So when we were talking about using the joints, the longer you're depressed, the more you isolate. So you're not smiling, and often you're not talking as much, and so I'm wondering if there's some stiffness that happens there too, that might be so.
More than likely. And I think there's a strong psychological component to many disease processes.
Yeah, that's part of it, and it just comes out in our body.
It exhibits somewhere, whether it's a skin rash or a TMJ or something. You know, if you're psychologically affected enough and your life is unhappy, I think you're going to see it in somatic symptoms.
Yeah, it's got to pop out.
Yes.
I mean, isn't that just kind of that thinking that you can't hold on, you can't stuff that forever?
And I think some of these people become obsessed with pain symptoms as a result. Yeah, I think it's one of the major psychological disorders that is mentioned in the study about TMJ.
Yeah, looking at somatoform. Well, you know, we've done other shows, like I mentioned, with with chronic pain. And I'm sure that it's very hard not to obsess about that. I mean, if every time you move, you're reminded of it. I mean...
Right, it's not like an ankle that you can, you can stay seated most of the time, or you can use crutches. It's pretty hard. You and I wouldn't be here if we couldn't use our jaws.
That's right.
We wouldn't be talking.
So then you would wind up having to be really careful about, well, you'd wind up being very selective about when you used it.
You get a very depressed affect is what you do.
Yeah, right, because it wouldn't move.
Right, and the muscles, and what happens is the facial muscles become very tense. And so these are people who talk in a way like this, and they don't smile because it hurts to smile, or it hurts to yawn, and they're very careful not to, when they laugh it hurts, and so they're real careful.
So they can come across as looking sort of flat.
Yes.
Just to save themselves some pain. We only have a couple of minutes, so let's talk a little bit more. We've, throughout this, talked about treatments. You've talked about night guards. You've talked about the little, opening and closing. What else happens to treat TMJ?
Well, one of the things we want to do is make sure that the mechanism of the masticatory system is in perfect function. We want to make sure that the way the teeth function from side to side and forward and back is in harmony with the muscles in the joint. And so one of the ways of knowing that if we were to do something to the teeth that would work is using this night guard. This night guard is also a diagnostic appliance. If you have TMJ and I make you a night guard and the symptoms go away, and then I find that I can produce the same type of function in your teeth as I have in the night guard, then I may want to go ahead and suggest that you have your teeth restored or modified a little bit so that your teeth work the same way as the night guard.
Well, I want to thank you for coming by. This is something you obviously know a great deal about, and we've had your phone number periodically. If you wonder if this might be you, feel free to call Dr. May and at least get a diagnosis and check it out. Thank you for coming by. Next week, we'll be looking at the process of change. I'm Mary Crocker Cook. Good night.
For topic suggestions, write to